My baby has not eaten in 2 hours. That is why I'm on my way to my second job tonight, because it is my responsibility to make sure that he eats, not the U.S. taxpayers. I am responsible for keeping him fed and clothed.
I'm stitching this because y'all need to see what's happening right now. A nurse, yes, a whole RN, got online and thought it was cute to mock people on SNAP benefits. Like, really? As if being poor is a personal failure? Her name's Tina Coleman, a registered nurse at Crenshaw Community Hospital in Laverne, Alabama. And she decided to go online and belittle people who rely on public assistance, the same people nurses are supposed to care for every single day. And let me just say this, when you mock people for struggling, you're not showing strength, you're showing cruelty. This kind of attitude makes the whole profession look bad. We've seen too much bullying, discrimination, and classism in healthcare, and it's time for accountability. Because when you humiliate the vulnerable, you don't represent nursing, you disgrace it.
So this is the ugly side of nursing culture we don't talk about enough. The performative, I work 2 jobs pride that disguises contempt for the poor. Nursing isn't about judging who's worthy of help. It's about care, equity, and humanity. And we've seen too many stories of bullying, discrimination, and classism in this field. It is time for accountability. The profession needs to study it, name it, and root it out. Because when you humiliate the vulnerable, you do not represent nursing. You absolutely disgrace it.
You know, it always amazes me how much people want to go viral so much that they're willing to risk everything they have to do it. Because you came on the internet and you mocked an entire group of people, like millions of people that need help every single day, putting basic food on their table, feeding their kids, meeting life's most basic necessities, and you're a nurse. Did you know that you have ethics that you are required to live under? And I don't know how it works, you swear an oath or whatever, but there are some ethics that you live under as a nurse. And here they are, Provision 1, the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. You literally have ethics as a nurse that you swear to that includes all of this stuff right here. And when you come on the internet and you mock humanity, you are directly breaking this. I wonder if your hospital has something similar in their mission statement. Oh, look at that. They do. The mission of blank hospital to care for our community by improving the health and well-being of the people we serve, regardless of their economic or social status, by providing healthcare, disease prevention, and health education services, regardless of their economic or social status. I don't think your hospital agrees with you. Now look, your secret's safe with me. I don't go that far. If you're going to come on the internet and mock people who need help, who actually work in many cases 2 jobs to be able to feed their kids, you're breaking multiple guidelines here. Just wanted you to know that this is not hard. Anyway, I hope you care for your patients that come through your doors more than what you portray on the internet, because I don't think that your employer would really appreciate this, your internet presence and the way that you handle yourself.
I need to know if Tina Coleman was fired from her job. If you don't know who Tina Coleman is, she made this super insensitive video about people on SNAP wearing her full nursing outfit, even her name tag. Not too smart, Tina. Your days are numbered at your job. I know where you work. I know where you live. I know your full name. I know more about you than I should know. It's 2025, Tina. There's people who have nothing better to do than investigate what you got going on. So let me know if she was fired. Love to hear it. Hope she was.
Tina Coleman, come on down. You're the next contestant on Fuck Around and Find Out. Tina's a registered nurse that works at Crenshaw Community Hospital in Crenshaw County, Alabama. To be confused with Greenbow, Alabama. According to this badge, it also looks like she's worked in home health care at some point. As a healthcare professional myself, the majority of my patients have to utilize such programs like Medicare, Medicaid, food assistance, Social Security, and disability. But how disgusting to see how she really feels about her patients. But Tina, I can't wait to see the grand showcase you win at the end of this Fuck Around and Find Out game.
Well, if it isn't the consequences of my own actions. What's up? What's up?
You know, there is something deeply unsettling when the very people entrusted to heal others choose instead to humiliate them. Nurses pledge their lives to the service of humanity. That is literally the first line of Nightingale Pledge: compassion, empathy, and respect for human dignity are supposed to define this profession. So when a nurse publicly ridicules the poor, that is not just an online mistake, it's a moral and professional breach. Today, guys, let us break down what happened, why it matters, and how this incident exposes deeper cracks in our healthcare systems. Cracks filled with classism, discrimination, and misplaced pride. Now, let's start with the core issue, mocking SNAP recipients. SNAP, Supplemental Nutrition Assistance Program, helps millions of people feed their children and survive tough times. For many, it's not a choice, it's a lifeline. In her viral video, Tina Coleman talks about working a second job to feed her baby every 2 hours, emphasizing that she does it herself, not the US taxpayers. On the surface, it might sound like a declaration of self-reliance, but in context, it came across as a jab at struggling families, a performance of I work hard and you don't. The reaction online was immediate and fierce. Nurses, healthcare workers, and ordinary citizens condemned her words as cruel, arrogant, and deeply unprofessional. Many cited a provision of the Nursing Codes of Ethics, which demands compassion and respect for every person's dignity, regardless of her status or income. What Coleman saw as empowerment, the public saw as elitism wrapped in a nurse's uniform. Here's where things take a deeper turn. This isn't just about one nurse and a viral clip. It's about what happens when healthcare professionals forget who they truly serving. The Nightingale Pledge, the moral cornerstone of nursing, begins with I solemnly pledge myself to the service of humanity. Humanity, not the wealthy, not the privileged, humanity. It's in its purest form, every single person. When a nurse mocks people who depend on SNAP or Medicaid, this isn't just mocking the poor, she's mocking her own patients. Because let's be honest, hospitals, especially community ones like Crenshaw Community Hospital, serve people from all walks of life, many of whom rely on Medicare, Medicaid, disability benefits, or food assistance. These aren't abstract groups. They are mothers, veterans, children, the elderly people, nurses, every single day. So when someone like Coleman chooses to go online and ridicule the vulnerable, it breaks an unspoken bond between the caregiver and the cared for. It sends a chilling message. If you're struggling, I think less of you. That is not just unprofessional, it's inhumane. Now, let's talk about the consequences, because this entire saga has become a living example of, well, if it isn't the consequence of my own actions. Coleman's words ricocheted across social media, amplified by outrage, disappointment, and disbelief. Critics were quick to point out that her statements violated not just public decency, but the ethical backbone of nursing itself. Provision 1 of the Nursing Code of Ethics states the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Every person. And yet, Coleman's comments reflected the opposite: contempt for those who have less. That is the dangerous seed of classism, the idea that someone's worth is tied to their income, their benefits, or their ability to work harder. It's easy to forget that poverty is not a character flaw. It's often a result of systemic barriers, generational inequalities, or medical hardship. Nurses of all professions are supposed to understand that. They see the human cost of inequality every single day. But this isn't just about ethics on paper, it's about culture. This incident peeled back a layer of what many healthcare workers call ugly side of nursing culture. A side that includes bullying, discrimination, and quiet elitism. When someone in a respected position mocks the poor, it reinforces those toxic patterns and tells others it's okay to judge who is deserving of compassion. And let's not ignore the institutional side. Hospitals often promote mission statements about serving everyone regardless of social or economic status. When a nurse publicly belittles people who rely on public assistance, that doesn't just stain her reputation, it damages her employer's credibility too. It makes the community wonder, can I trust this hospital? Can I trust its staff? Because once the public sees a nurse mocking those who struggle, it undermines the sacred trust between patients and healthcare providers. That's not something a PR statement can easily fix. Now, here's the lesson buried in all of this. The internet never forgets, and neither does accountability. When you post something cruel, condescending or discriminatory, especially as a licensed professional, you are not just representing yourself, you are representing your profession, your employer, and the values you swore to uphold. For Tina Coleman, the backlash was swift. She became, as one commentator put it clear, the next contestant on Find Out. But beyond the memes and outrage lies a critical truth. We need to confront those moments, not just cancel them, because every time a nurse or healthcare worker ridicules the poor, it widens the gap between caregivers, the communities they are meant to heal. It perpetuates stigma, it erodes empathy, and it teaches young nurses that compassion can be optional, that ethics can be put aside for clout. That is why this story matters. Not just because one nurse went viral for the wrong reasons, but because it shows how performative self-sufficiency, the I work two jobs, you should too mindset has no place in healthcare. Real strength isn't in mocking the vulnerable. It's in standing beside them. Real professionalism isn't about bragging how hard you work. It's about how deeply you care. At the end of the day, nursing is about service, not status. So to every healthcare worker watching this, remember, compassion is your calling card, not your caption. Tina Coleman's story is a cautionary tale, not just about social media mistakes, but about what happens when empathy leaves the room. Because the moment we stop serving humanity, we stop being human. Guys, drop a comment below. Let me know what are your thoughts about this particular topic. Also, remember to subscribe, like, and share as well. And until next time, bye-bye.